Thanks for joining us for the news at 6. I'm Morgan Romero. Idaho health leaders like where our state is heading. COVID cases statewide have been trending downward for more than a month. However, Health and Welfare's website says local health districts are still waiting to process more than 14,000 positive tests. Andrew Bartline spoke with health leaders in a media briefing today and with the largest local health district. With incomplete data, Andrew, how do we know that these trends are really accurate and give us a full picture?
Well, both our local and state health leaders tell us that the backlog tests are updated retroactively. And with the vast majority of these backlog cases coming from January, the downward trend through February shows accurate and up-to-date numbers.
Central District Health is hard at work, chipping away at nearly 5,000 backlogged COVID cases in their health district.
Recently, the numbers are very close to being accurate.
Communicable Disease Program Manager Dr. Lindsay Haskell says 4,500 of the backlogged cases are from January, meaning fewer than 500 tests are missing for the month of February. She says this downward trend in COVID cases through her district is largely accurate, but adds the process of tracking and reporting cases is flawed.
It's likely just the tip of the iceberg is what we're seeing. Someone has to seek testing, test positive, and it has to be reported for us to know about.
Haskell says CDH often cross-references their case count data with outside numbers to get a complete understanding of local COVID levels.
Wastewater is a great indicator.
Through the pandemic, Haskell says the city of Boise's wastewater COVID-19 viral load has reflected the same trends as their case counts. Both the wastewater viral load and CDH case counts have trended downward for more than a month.
Things are better. It feels better. Hospitals seem less stressed. Cases are going down.
State health leaders are pleased with these downward trends that are also reflected in the statewide case count. However, they're looking to move away from COVID case counts in general.
We've been, I think, talking about this for a while.
Health and Welfare says counting COVID cases doesn't offer much value. State epidemiologist Dr. Christine Hahn says the department is inching closer to treating COVID like influenza, where cases aren't counted, but the ability to manage those who are sick is.
Really focus on the burden on hospitals, burden in the communities, outbreaks in congregate settings, that kind of thing.
Now, at the end there is alluding to new CDC guidance for local health districts that really focus on data points that are relevant to that local area, things like COVID cases per 100,000 and the number of severely ill people relative to local hospital resources. Morgan?
Well, I think what she just said, that's been the point throughout the pandemic. We want to decrease the cases so that we don't inundate the healthcare systems and it affects everybody else. So important note there. I'm also curious, did they talk about how while cases are declining, we aren't seeing hospitalizations and deaths necessarily that low yet? We did report several new deaths.
Well, we do know traditionally they lag behind, so
Okay.
that's kind of how that's gone.
Okay, we'll keep our eyes on that data. Andrew Bartline, thank you.